Thanks, Mark. I think I'm ready to run the next leg on this relay. Before I launch into the talk, I want to say a number of things by way of thank you to the group for inviting me and to allow me to choose a topic rather than assigning me this topic. And you'll see that gait analysis certainly has a role, but it hasn't really panned out in the way that it was first envisioned. First, there's a very long history. Edward Muybridge in the 1870s did some very innovative things that really were the precursor of motion pictures. These were taken static pictures of a horse galloping or cantering. And he was first to show that at one point in time, all four hooves were off the ground and that the horse's body remained parallel to the ground. He did the same with humans, once again, using tripwires before much technology was available and multiple cameras. And he took a sagittal and frontal plane view of someone running. Technology moves on, and in the 20th century, a great deal was added to the concept of motion analysis, in particular gait analysis. And it became more than just an observational test. Here we see reflective markers on a subject. Their right foot is on a force plate, which is embedded in the ground. And the surface, the ground has to be dampened so there isn't a lot of reverberation and secondary input to the force plate. So a special room has to be devised. And you see here a camera which samples at about 10,000 frames per second. So you not only have the motion, but you can analyze this in very great detail and high resolution. What you see, or what you generate, are these beautiful diagrams showing the motion at the segment that you're interested in. And you can also add torque by computing force times distance, once again, having captured all that from the markers. So you gather an awful lot of information, and a lot of it's analyzed instantaneously now. You don't have to feed this into a computer any longer, which is what we did in the 1980s. It comes right out. And one of the most useful applications has always been in looking at a patient pre and post surgery. And as Mark said before, that's one of the elements of showing the value and efficacy from a biomechanical standpoint of an ankle replacement versus an ankle fusion. And once again, an attempt in the 1970s by Mazur to compare the two was done with very rudimentary technology. And those studies have been repeated, and the difference is quite evident that we learned a lot more with this sophisticated imaging and force gathering. You could also add surface electrodes if you want to know when muscles are firing. They're not as accurate as needle electrodes, but they certainly can be used. And you could put a respirator on the patient and see what their oxygen consumption is to learn about the overall energy consumption during their strides. So come a long way. And what we have is what you want the imaging to show. Most likely you'll get the most information from 2D analysis. That is, you create a X-plane or a Y-plane, a sagittal or a coronal plane, using all the markers and the cameras which are arrayed around the patient while they walk. You can also have the patient run, hop, skip, jump, climb a few stairs, and there are other applications now beyond gait and running. So with new computer software, you have the ability to generate, once again, a great deal of information from one single study. There is 3D kinematics now. That is, we can take the Z-plane, which is taken from cameras up above, and you can add that if you like to create 3D models moving through space. And once again, you add force, so you can calculate torque, and you can also note any asymmetries in the Z-plane that you may not quite see on the sagittal or frontal plane. All this is progress that's come from advanced engineering and technology. So with the same markers and force plates, you could add a second force plate, you could add a third or a fourth force plate. You can certainly gather much more information and generate much more detail in motion of the entire person and of different body segments. Here, once again, with the markers, you have a linear array of displacement of those markers, showing you where different segments are in space and time. And you add to that, when the foot contacts the force plate, you can determine shear, you can determine axial load, you can even determine whether there's axial rotation going on at that instant when the foot meets the force plate. The force plates that are most commonly used are a strange gauge variety, the piezoelectric, much more expensive, much more finicky, but they can give you better measurements, more accurate measurements for high force. That is, you're having someone jump and see how they take off and land rather than casual walking. So once again, the science and the engineering move on. Here on the stick diagram or cadaver diagram on the right, this is actually a study ongoing at the University of Virginia now with a subject on a climbing wall. And the idea here is to learn and apply certain training techniques to how soldiers or combatants would deal with something they have to climb and scale. And so you can then operationalize the training techniques to maximize torque at the different joint segments. And here is an example of upper extremity motion analysis in someone who's carrying an object while they're walking, such as any number of laborers, to see how it affects the pelvic array versus the ground and the joint motions. One of the most expansive use of gait analysis in the 1980s and 90s was on children with motion disturbances, mostly CP, but spinal muscular atrophy was pretty well studied. And what this did was confirm what the expert pediatric orthopedist was seeing, but it also gave you a basis for comparison, once again, to a pre and post torque, segment motion, energy expenditure, et cetera, for a surgery on a child that could benefit from procedure. One of the more helpful elements is metabolic efficiency. And as I mentioned, you can determine oxygen consumption. You could put a backpack on someone and have them walk before and after and see how their energy efficiency changes. And to see if there are any gait changes, you can have them climb 2 or 3 steps before getting on the platform, et cetera. And you learn a lot by, as Yogi Berra would say, you learn a lot by observing. And that's what many of these studies do. You have to ask the right question, but the availability of the lab to answer the question has really progressed over the years. And the efficiency has to do with the time and the difference in the joint angles, and very easily measured now with accurate reproducibility in a modern gait lab. So in summary, there is a valuable tool out there for analyzing gait disturbances which you either wish to follow or see how you've improved or changed their gait with a surgical intervention. You can also measure improvement in any number of ways, and you can optimize gait. You can instruct a physical therapist or a rehab physician into what you'd like to see optimized before surgery with exercises or stretching or other modalities which lead up to an improved output in post-operative management. One of the things, I did a short study years ago showing that patients who are going to get total ankle, if I can improve their dorsiflexion strength, they had subjectively better results, though their range of motion was the same. Things like that can be put through a gait lab at will. The sports community really has a great application, weighting. Some use this, some don't. The problem has been almost from the get-go that these are expensive tests and they're not reimbursed by insurance. So that's greatly limited the application of this over the years. What we did in the old days is we would charge for an initial physical therapy visit and have a physical therapist available for all, but we did not find that was sustainable. You need outside resources to make this work. Thank you.